Hi everyone, this is Upasna, your friendly neighborhood scientist, and today we shall be talking about vaccines. Now, before you watch this video, you need to know the basics of the immune system and how pathogens infect us. So, if you haven't already watched the previous two videos, please click on the link in the description box. And if you have, then let's get started. The story of vaccines begins with one of the deadliest diseases known to humanity, called smallpox. Its kill rate was higher in children, and the survivors were left with extreme scarring and even blindness. Smallpox was known to be airborne within a radius of 6 feet, though it was also transferred by touch. Used clothes, bedding, etc. could also cause infection. The first attempt at what evolved into vaccination was a method known as inoculation. The oldest known records date to 1549 in China. Old texts suggest that it spread across Circassia, Turkey, and even India. In this method, healthy individuals are exposed to used cotton plugs or other material from a smallpox patient in the hope to generate an immune response. However, the immune system and viral diseases were not well understood at that time, and the individuals often developed full-fledged disease. Thereafter, a scientist called John Fuster observed that individuals exposed to cowpox did not develop smallpox. This was concluded after investigating a common observation that most milkmaids do not develop smallpox. Meanwhile, a farmer from Dorset named Benjamin Jesty decided to use his wife's knitting needle to infect their family with cowpox. None of them developed smallpox. This is where the physician Edward Jenner, who is often touted the father of immunology, comes in. Jenner also independently observed that milkmaids did not develop smallpox. Therefore, he injected the pus from infected cows into an 8-year-old boy. He followed this up with a standard smallpox inoculation. The boy did not develop smallpox. He repeated this successfully with 21 people and thus came up with the first established vaccine. Eventually, we learned that the key or antigen is quite similar in cowpox and smallpox as they are related viruses. However, cowpox was not as deadly. Therefore, cowpox could be used to safely activate the B cells so that when the deadlier smallpox arrives, they can immediately fight off the infection by mass producing antibodies. Most vaccines depend on the same principle. Some aspect of the pathogen is injected into the body depending on the strain you want immunity against, and although it is not a real threat, the body will develop a full-fledged immune response. Diseases like smallpox and measles were completely eradicated at one point by vaccines. Vaccines can be of various types. Live attenuated vaccines employ a weaker or asymptomatic strain to develop immune response. Using cowpox against smallpox is the oldest example. These are the most effective kind, although their development takes the longest to ensure that they are indeed safe. Immunocompromised individuals cannot be given these vaccines as their systems are too weak to fight off even a weaker strain. Inactive vaccines rely on dead pathogens. Common examples are vaccines against polio and hepatitis. While these can be safely administered to immunocompromised patients, they do not generate as strong an immune response as live attenuated vaccines, since phagocytes may do the job without activating memory B cells. This is why booster shots are required for such vaccines. Subunit vaccines use a specific protein or carbohydrate from the pathogen to generate an immune response. The influenza shot is a common example. More novel are the mRNA and DNA vaccines that hold genetic information that codes for a specific protein from the pathogen. When the protein is created in the body by the body's machineries, it instigates an immune response. This brings us to the question, how quickly can a vaccine be developed and why does it take so long? So typically, vaccine development occurs in 3 stages. The first is preliminary research, where the fundamental work is done to develop and test strategies for the safest way to trigger the desired immune response. No single approach is guaranteed to work in the future. When a pandemic breaks out and there is a time crunch, many labs work simultaneously. The approaches that work are taken further, while other labs continue to scout for new options. This is how the first testable vaccine against COVID-19 came out in just 42 days. The next phase is of clinical trials, which itself have 3 phases of testing with multiple tests to determine efficacy, required dosage, and possible side effects. This makes it the longest and most unpredictable phase. As many strategies may not work out, it can take up to 20 years. When on a time crunch, scientists try to run some phases in parallel or reuse vaccines developed for similar pathogens in the past. Repurposing the seasonal flu vaccine helped develop the viable H1N1 vaccine within just 6 months. Post-successful phase 3 trials, regulatory authorities review and approve the vaccine for mass manufacturing. When time is crucial, manufacturing protocols should be optimized alongside the research and testing so that production begins immediately post-approval. Thus, vaccine development requires constant coordination among scientists worldwide, an ability to quickly adapt to changes, even if it means scrapping an entire year's worth of research, and enough time and money to enable the development of safe and effective solutions. One way in which DNA and RNA-based vaccines can save time is using a universal base material and swapping only the genetic information. This can enable skipping some of the testing phases. In an age of growing misinformation, many people have developed some misconceptions about vaccines. One is that vaccines cause allergies and autism. Studies suggest that vaccines actually reduce allergic reactions. While one study tried to correlate vaccines with autism, it turned out to be false data, and 25 research groups have independently debunked this myth in reputed journals. Secondly, people are wary of chemicals in vaccines. Yes, vaccines do have chemicals. We are made of chemicals. For example, each dose of vaccine has about 0.125 mg of aluminium. But foods like spinach, tea, and potatoes naturally have trace amounts of aluminium. We consume 30 to 50 mg of it per day. People often assume that vaccines only help those who take them. However, they help the immunocompromised through the development of herd immunity. Vaccines help populations develop immunity without risking a huge number of lives. Thus, the number of people at risk and the spreading power of the disease goes down. This improves the safety for the immunocompromised. That's all for today, folks. If you have any questions, please let me know via the comments below and I will answer them to the best of my capabilities. I hope you have learned something today and you had fun. So take care, stay safe, and please vaccinate your kids, please vaccinate your fur babies. Bye bye.